Good morning, all. You are all welcome to this orientation on Mdcn assessment examination that is hosted by Medtutors par excellence. And the overall aim for this orientation is to help candidates improve on their outcomes for this examination, and also to clarify issues regarding preparation for the examination. And we are going to go through a lot of points that are based on experience in participation in this examination at various levels. Because we should know that careful preparation will set you up for success. And when you go through a proper preparation, it will prevent a poor performance. I will start by introducing myself. My name is Dr. Bashir bin Yunus, a consultant general surgeon. I obtained my MBBS at Ahmadu Bello University, Zaria, 2010, and also obtained my MSc in Surgical Sciences, then my fellowship with the West African College of Surgeons. I've been involved in training of MBBS students preparing for their final exams for the last 10 years in a teaching hospital, and also preparing candidates preparing for these assessment exams for the last 7 years. And I participated as an examiner for the Mdcn exams. And I authored some books, and this forms the basis for giving you this orientation based on my personal experience with interaction with students preparing for these exams, and also from experience acquired from guiding candidates preparing for our own MBBS exams using our local curriculum here based on the nature of our training in this environment. Now, straight ahead, you should understand the goals of Mdcn assessment exams. The goals of these exams is to ensure a candidate has a good foundation of the basic and clinical sciences in medicine and dentistry. This is the major goal of the assessment exams. Candidate who is about to be licensed should have a very good grasp on the basic foundation of medicine. And to ensure that a candidate has an adequate exposure to clinical medicine. And a candidate has a good interaction and communication skills with patients, and should be conversant with peculiar and common conditions in the tropics, and also with the MBBS curriculum in Nigeria. So the overall goal of the Mdcn assessment exams revolve around these basic goals. And the aim of every candidate should target, okay? Your goal should target adequate preparation, because if you fail to achieve these goals, it will lead to inadequate preparation. Now, we are going to start our discussions by how to prepare for these exams. At the end of the orientation, please, you should take down questions, okay? Note down your questions, which will have a question and answer session, and we'll discuss all the gray areas, okay, you need clarification about. Now, the first point you need to know, okay? The first point you need to know is what you are expected of in preparation for these exams. What you are expected of. Now, in preparing for any exams, not only Mdcn exams, you should know the subjects involved in that exams, okay? For Mdcn exams, subjects around clinical sciences and public health are the topics that are discussed: internal medicine, surgery, obstetrics and gynecology, pediatrics, and public health. Questions are distributed evenly around these subjects. And you should also understand the structure of the exams. Now, you should know in these exams, questions are distributed evenly all through the curriculum on the outline topics for undergraduate MBBS exams. Of course, there are some high-yield topics which I'll give a separate talk on the high-yield topics for all these subjects. But you should know that as long as you are writing an MB exams in Nigeria, they have a standard they use for the MBBS curriculum, and they spread these questions evenly on all these subjects. Now, you should know the structure of the exams is both multiple choice questions, picture tests, as well as OSCE. What is the aim of the multiple choice question? The aim of this multiple choice question and the picture test is to assess the depth of your knowledge as well as the width of your knowledge. You cannot go for an Mdcn exams and you are not well read, because the MCQs will definitely, okay? The MCQs will definitely affect how deep. Some candidates, I saw a message that they can't hear. Can all of you hear me? Okay, maybe it's from their own setting. Okay, you cannot go for any professional exams in medicine when you are not well read. Because let me tell you, most of the candidates that fail the exams because of the MCQs. Because this assess how deep you have prepared, how broadly you have read over this subject. And the OSCE assess your clinical acumen, your level of interaction with patients, as well as your discipline. And this your discipline, your manner of behavior during a clinical exam, starting from your dressing, okay, and your politeness to your patient as well as your examiner, and trying to maintain medical ethics. So these MCQs and picture tests, there are 300 questions. Okay, you have 50 from each specialty, then 50 picture tests. Then you have 10 OSCE stations. Now, for you to answer 300 MCQs in an exams and come out successfully, you know, one of the most important secrets is frequent practice. One of the most important secrets of passing this MCQ successfully is frequent practice. And I will tell you how to practice for these exams. How do you practice for MCQs, especially when you have so much MCQs to answer in a sitting? Now, one, you practice. You should have a timed practice. For example, you have 100 questions, okay, and you want to answer them in 60 minutes. You get a stopwatch for that. Okay, you time yourself and see how many questions you will be able to answer in 60 minutes. So you timed yourself. That is one step. Okay, this should be frequent and regular. It prepares you for any form of multiple choice questions. Two, you study MCQs. Now, you should notice the difference between these two. Studying MCQs, you can use the whole day to study 100 questions. It's not a timed practice. You do this, it helps you read broad and wider, and you cover a lot of topics within a very short time. Okay? Because if you don't do this, you have problem. You can't be reading without practicing. And you should know, passing this section is the most important and determining factor for any candidate that scales the exams. Now, let me tell you, based on my experience in marking so many MCQs, when you give candidates combined mock, you find that even though if this candidate does well, if you give him a particular subject, but if you give a candidate combined mock, most of the candidates fail the MCQs, and those that pass are just a little above average. So the only way you can overcome this is when you frequently practice. And from the assessment, when you ask candidates after the exams, especially those that did not pass, they will tell you that they did not finish. And what is the cause of this? Is due to insufficient practice. Let me give you an example. If you are asked to answer 100 questions, because of your poor time management, within 1 hour, you answered 60 questions. Automatically, you have failed 40 questions automatically. So your assessment will be based on these 60 questions. Now, in these 60 questions, you are not getting 100%. Let's say you get 35. So it will be overall 35 over 100, which is fail. So this is the most common challenge that most candidates face in their Mdcn assessment exams. They fail the multiple choice questions due to lack of time, and this is caused by insufficient practice. So they have poor time management. So don't forget, with regards to these MCQs, you should have a time practice. I'll tell you how to do that. And also your study time. This time practice is to help you in developing good time management. When you have a good time management, you won't have problem with the exams. And you study MCQs, okay? This is not restricted to maybe you want to answer 100 questions. You can use the whole day to answer 100 questions. It will give you opportunity to read widely. Okay, regarding the OSCE, what you need is repetition. You have to be repeating all the components. At least, you know, there are some constant aspects in an OSCE for Mdcn assessment exams, examination stations. These are constant. Know all the examinations that usually feature in the exams, and you practice them repeatedly with a very serious partner. Levels of prevention, all the common diseases. In fact, you can apply this properly to all the disease if you understand the concept of level of prevention. In an OSCE station for these exams is constant. Counseling stations. Now, I found most candidates having problems with their preparation. They pay more time in studying this counseling, level of preventions, examination, when they have not read well. You should pay a lot of attention to covering of your curriculum. covering of all the subjects. Okay, read wide. Most of the time, you should be attempting to cover the curriculum for all the outlined subjects. Okay, level of prevention and all other OSCE stations, you should do them regularly. Okay, especially when it comes closer to the exams. Okay, but most of the time, please prepare more for your MCQs and picture tests, because it's an important cause of failure in the exams. Okay, so we've talked a little on what you are expected of, the subjects, as well as the structure of the exams and what each of these aspects assess in you. Now, this is also a very important aspect and major challenge I find candidates preparing for these exams. They don't read standard recommended textbooks. Candidates preparing for these exams, I notice, okay, they rely on tiny key points, notes, which can never be used for preparing for an MCQs. 300 questions, you are using a key point to prepare for that exams. That is almost impossible. So you need standard recommended textbooks. MBBS exams is a standard exams. You don't expect these examiners to be setting MCQs from tiny pamphlets, tiny key points. Okay, you cannot acquire knowledge from key points. You cannot acquire knowledge from tiny pamphlets. You need textbooks. Now, how do you use these textbooks? Now, we have some recommended textbooks for training in Nigeria that covers tropical issues in all the subjects we mentioned, in surgery, medicine, okay, ops and gynae, public health, pediatrics. There are standard recommended textbooks that deal well with all the high yield topics. I'm not telling you to read a textbook from page 1 to page last, no. Now, when you are topics for these exams, when you are reading the high yield topics for these exams, please and please read from textbooks. There is no shortcut in acquiring knowledge. There is no shortcut in acquiring knowledge. Please and please, you must read deep and you must read wide. Now, I found some candidates who write these exams multiple times. They keep on making the same mistakes. Okay? They keep on making the same mistakes. If you write an exams 1, 2, 3 times, you can reevaluate yourself. What am I doing wrong? Am I reading the right material? Am I on the right course? There is no way you have a text that has an information A, which will be used for certain questions. Okay? And you are using texts B that don't have all the information for setting this question. How do you expect to see, how do you expect to pass that exams? What you will see and the challenges you will be facing in that exams, you will see a lot of new information. You can't be making discoveries in an exam hall. There is a very slim chance of you passing when you are seeing the information for the first time. You don't go to an exam to be thinking. You are going for an exam to deliver information you have been preparing for a very long time. Okay, so please and please, you must read from standard textbooks. Don't make mistakes of not getting right materials. And by the way, if you are to read textbooks, you know you must buckle up, okay? You cannot achieve excellence from reading from tiny pamphlets. You have to read. And reading from textbook means you require more time, okay? You require more dedication. You require more commitment, okay? And you should remember, in medicine, that's what you are trained to do. You read books, okay? Don't look for shortcuts. So the point I'm making here, you must get good textbooks and read all the high yield topics from textbooks. I'm not discarding all those short pamphlets, all those short key points. You only use them after you have read. You only use them for group discussions, please. They should not be your primary source of information. You only use them to recall the points you have read and during your group discussions. Now, getting qualified trainers. You know, training in the field of medicine is a tradition. Please, you should know this. In the field of medicine, knowledge is transmitted following hierarchy, because you must get somebody who is an expert in the field, in that area of specialty that he's delivering knowledge, okay? Okay, one must be qualified. Otherwise, it's dangerous and even unethical in the field of medicine, because false information are harmful and may jeopardize life. You are dealing with people's life, information to save life. And if you remember, amongst the principles of medical ethics one is what? Non-maleficence. First, do no harm. So you must get your information from qualified trainers. Who are these qualified trainers? On the tradition is a consultant, okay, who is a master of that field he's teaching. But of course, you know, this is not readily available. You can get your knowledge from senior registrars. resident doctors. Why these three? All these above, one, they are in a teaching and training environment every day. Two, they take part in the examinations in centers where these exams are conducted. They are always part of the exams, so they will share their experience and all the mistakes candidates make during these exams. Well, medical officers with experience can also teach you. However, it should be under supervision. You can't have a double-blind trial, the blind leading the blind. You must know, you must have what it takes to impact on others. Okay? So please and please, make sure you get a qualified trainers who have experience in training and who have experience with the exams, are also involved in this examination. They know how the setting of the exams is. Sometimes it might be very difficult to get this, but I know there are a lot of medical officers out there who are experienced, but even so, they should be supervised by those that are involved in training. Because I've encountered a lot of candidates that say a lot of incorrect information and they were taught. So that is very dangerous. Now, active participation during preparation. You see, let me tell you, there is no way you are sleeping and overnight you just come and write these exams and pass. You have to be actively reading, okay? You must be actively involved in discussion of past questions, group discussions. You must be actively involved in various mock examinations that are organized for you by your various training centers. See, one thing you need to know, you all finish from well-accredited universities. There is nothing new you are going to be taught. It's just guidance on the exams based on experience, okay? So you have to actively participate during your preparation. Of course, you have a very short time, okay? You have a very short time to prepare, mainly 4 months, 6 months for those who start earlier, okay? So how will you write an exam that you are not ready for? How will you be ready? Please and please apply yourself actively. Read, okay? You have to actively participate in group discussions. Now, you see sometimes when I'm delivering a lecture, you will see a full house. Everybody will be in participation. But on the weekend, when we have mock, you will see only 1/3 of the class. Everybody will disperse and run away. Now, the idea of mock is for you to assess yourself, what you know and what you don't know. You are given opportunity to make all your mistakes during the mock and also to remove your fears so that you don't make such mistakes during the main exams. That is the idea of mock exams. There's no way you come for a training, you listen to lectures, and when you are about to be assessed, you run away. So it means you are taking the lectures as just entertainment. Okay? So please and please, active participation is very paramount. Okay? Okay, during revision, maybe a month to the exams, you must participate. Revise all what you have been studying over time. Okay? Interact with your tutors. Ask questions. You have to interact. You have to ask questions. Okay? I see there are a lot of questions coming in. We have a question and answer session. Okay? We are going to tackle all your questions. That is not going to be a problem. So now, cover most of the curriculum. As I said earlier, you should not be encountering many new topics for the first time. During the examination, it means you are not ready. When you are seeing a question on a topic you totally have no idea about, it means you have not covered enough. Now, of course, you start with the high yield topics. You must understand what you are up to. What is expected of you? That is the first thing we discussed. It's very, very dangerous to go for an exams and you are skipping so many questions, especially in the multiple choice, because you've never seen them before. You have no idea about those topics. So that is the major cause of failing an MCQ. Because MCQ, as we mentioned, assess the depth of your knowledge and the width of your knowledge. And for you to cover most of the curriculum, it involves a very active, highly organized, commitment, focused reading, group discussion, and asking questions. You require a high level of active participation, high level of organization, high level of commitment, and focused reading. When you are reading irrelevant material, surprisingly, can you believe 4 weeks to exams, a candidate is asking me if anatomy is part of the exams? You see, this candidate is totally confused. He doesn't even understand the scope of what he's up to. So please and please, you must cover most of this. Now you should have a guided group discussion using relevant materials with individuals that show commitment. Unfortunately, when you divide candidates into various groups and give them timetable, days they are supposed to come for group discussion, unfortunately, you see only few of them coming. You have group, you say group 1 to 5. Okay, maybe you see only one group active. Some of the candidates don't even know they are the group leaders of a particular group. And they will be affecting others that are serious in that group. And ultimately, the group will shatter. They will start running to a serious group. So you must show commitment. Okay, you must be dedicated. And if possible, your group discussion should be supervised by a senior. A senior meaning someone who has written these exams before. So what I normally do is, for every group, I assign a senior person who has written this exam before so that he moderates the activity of the group. But unfortunately, some of the groups will even discourage that senior person that is coming to supervise and guide the group discussion. And overall, you will see the group will just shatter because of lack of seriousness. Now, it should be MCQ based and picture test, not that you just go and sit down and be gisting, eating groundnut, eating that, making noise, disturbing you. No. You should have a focused group discussion, a target group discussion. You know what you are there for. Okay, you said we have 2 hours, we want to cover 100 MCQs. You focus on that, finish everything within the stipulated time. And during your MCQs, you should have textbooks kept aside for confirmation if there's any doubt on any information that is passed. And your group discussion should have a regular physical examination. You should have days you do physical examination. Now, the point here, if you are discussing MCQs and picture tests 4 times a week, for example, you should do physical examination once or twice a week. And all other aspects of the OSCE. And you can see this active participation can never be overemphasized. Now, I'm telling you, based on experience, I have most of those candidates that pass these exams, they are actively involved during preparation. Those that are actively involved that did not pass the exams, most of the time is from exam accidents. Now, everyone should understand the key players for preparation. Number 1 is determination. You must be highly determined to achieve your goal. You must show commitment. Okay? Because without commitment, you can never start anything. You will always be left behind. And you must be consistent. Because without consistency, you will never finish. The driving force of any preparation or preparation for any exam is determination. You must be determined. You are not going there to attempt an exam. You are going there to pass an exam. Now, organization, you need to be highly organized. Okay, you should have your lecture notes. Surprisingly, you see candidates. You are delivering lectures, they will just sit down and be looking at you. They don't even have pen. They don't even have paper to jot anything. They will just sit down and be looking at you. You deliver a 2 hours lecture. I assure you, you should know the way to preserve knowledge. The way to preserve knowledge is by writing them in books. You cannot memorize everything you are being taught. So you should get a comprehensive, a very good, preferably hardcover lecture notes to jot down your lectures, review your lectures after the lecture, add more, give space where you want to add more to that lecture from your textbooks. Jotters, you should have a very good jotters. Jotters are different from your lecture notes. Jotters, during your personal reading, I'm not talking about rough books. You just have papers everywhere. You see papers, you just write on a rough paper, you discard it, get another rough. No, you should have a very good jotter. When you are doing preparation, you jot down things that you review and even add to your lecture notes. You should have a reading timetable. If you have reading timetable, you can even assess yourself on what you have covered, what you've not covered. Because you are organized and you are going through a regular and a repeated practice. So you should have a reading timetable. You should have a group discussion timetable. You can't just be doing discussion every day. After all, it is the knowledge that you acquired during reading, that is what you come to discuss. You cannot discuss when there is nothing upstairs. So you should have a reading timetable, you should have a discussion timetable, and you should have a practice timetable. When I mean practice, it should be timed. Don't forget this. You get 100 MCQs, and you want to answer in 60 minutes. At the end of 60 minutes, your stopwatch goes off. Then you assess how many questions have I answered in 60 minutes. So I assure you, if you do this regularly, in half of this time, you answer 100 questions because what? You are used to it already. So organization is a key player to your preparation. Now, frequent practice and revision. I always tell students, repetition is the secret. Repetition is the secret of learning. You don't need to be a genius. You don't have to be a genius to pass any exams, no matter how difficult it appears. Just do one thing. Just frequently practice. And I assure you, if you do this, you will tell me one day, this is the reason why I passed my exams, because I frequently practice. Now, you have to be very optimistic, very hopeful. Don't allow yourself to be broken or discouraged by anyone. You see, a lot of people have false impression, and this false impression develop when they have attempted multiple times. Instead of reevaluating themselves to see where the problem is, provided there are some candidates that pass these exams. And I believe you've never seen anybody with two heads in that venue. Provided people are passing these exams, that means something is wrong somewhere. It is a passable exam. You also can pass that exam. So never allow yourself to be broken or discouraged by anyone. That no, it's not a passable exam, because that candidate that is saying that, he has been repeating same mistake over and over, and he has not been guided properly. Never allow anyone to tell you that you cannot make it. Anybody that tells you you cannot make it, that person cannot make it himself. Don't walk on hearsay. Just be the best of what you are. do the best of what you can do and be the best of what you are. And I assure you, you are going to make it. Let me tell you a small story. There was a time a colleague came with her grandmother with intestinal obstruction. This patient is a mother of 2 consultants, colleagues, 2 registrars in the same center where I work. When the patient came, I realized everybody was dodging from the patient because they don't want to be involved, and something happens, they will now be pointing finger at you that this is the person who operated so and so mothers. Everybody starts saying, Dr. Bashir, this is your patient. Dr. Bashir, this is your patient. When I came and reviewed the patient, I told myself, I was trained to be a general surgeon. And this is a condition I was trained to manage. Why will I be afraid of managing this patient? Let me just do the best of what I can do, following the principles and adhering to medical ethics. What I'm telling you, this woman is still alive, over 1.5 years now. So if I would walk on fear, lack of courage, hearsay, I'll also be scared. And when I'm jittery during that procedure, something might happen. So please and please, you are all medical doctors. You are trained to become medical doctors. Never doubt yourself. Just do the right thing. Bring out the best in you, and I assure you, any exams that is presented to you, provided you have done your homework, you are going to be successful. So these are some of the causes of failure and how you avoid them. Now, most candidates fail to understand the scope of these exams, what you are supposed to cover before the exams. We've talked about this, the subjects involved, the structure of the questions, areas these questions cover. You have to read all these areas, understand the scope. To avoid failure, you have to buckle up, try the best, give the best in you, cover most of the curriculum for these exams. Now, reading wrong materials. You can't be preparing for an exams where questions will be drawn out from material A while you are reading material B and expect to pass. That is impossible. So when you read wrong, irrelevant materials, the exam will appear extremely difficult. But if you read the right materials, the exams will appear very simple because you'll just be coming across things you have read. It's just like you walk over. Now, there are some candidates, unfortunately, they keep on repeating the same mistakes. Failure. When somebody fails an exam, it's just a wake-up call for you to reevaluate and prepare further. It doesn't mean those that pass the exams are better than you. They are only better at preparation They prepare better than you, and they are well focused. You see, some candidates, they take things too lightly, okay? They don't participate, involve themselves, and when they don't pass, they will now start raising a lot of theories, okay? So there are so many false impressions about these exams, okay? They will say this, they will say that, they will say that. Please and please, let me warn you, block your ears from all these false impressions. Just do your best. Do what you are supposed to do. And I assure you, you are going to succeed. Don't allow anybody to discourage you. You have gone a long way studying MBBS. Okay, just an assessment exam shouldn't be a stumbling block of progress in your life. Because when you remain stagnant for not passing this exam, you can't practice. And everybody moves on. Okay? So just give it time, do what you are supposed to do, and you rejoice at the end. Lack of active, inadequate preparation. You can't just be sleeping, you just wake up and just read some few pages and go and write exam. No. You have to be with those people that are preparing for this exam. And you are actively involved. Don't be, you see, what I notice about some candidates, during group discussions, they don't say anything. They don't contribute. They don't volunteer to examine. They are only spectators. They know all the wrongs a candidate. They can pick out all the mistakes in a candidate. They are good at talking. But if you ask them to do, they will draw behind. So you have to actively participate. Active participation gives you an upper hand. Ask questions. Be the one to talk. Don't be an observer. Don't be a spectator. You have to actively participate. Be the one to raise questions. Be the one to answer questions. Be the one to raise up assignments. Now, too many distractions. Okay? Please and please, this is just 4 to 6 months. Cancel so many unnecessary appointments. Face this, then you continue your life. You see some candidates deceiving themselves that they are reading from their phone. They will spend 5 minutes on the document they are reading, 35 minutes on Facebook, WhatsApp, Instagram, and all the social media. Then after an hour, they will leave the library that they had a quality reading. You are just deceiving yourself. So too many distractions should be avoided. Candidates, see, you can't just be deceiving yourself that you are reading when deep down in you, you know you are not covering what you are supposed to do. Anything that is a source of distraction, please keep it aside. After your exams, you can continue. Because I know how painful it is for somebody to remain stagnant because of a licensing exams. You can't practice. Your colleagues have already commenced their training, specializing. Some have already gone far, and you are still battling to get a licensing exams. See, challenge the licensing. What is a licensing exam? What is the big deal about licensing exams? After spending 6 years acquiring an MBBS certificate, just say to hell with it. Let me sit up, buckle up, clear it once and for all, and move on. Now, wrong team members, please know there are some guys that are so unserious and they influence you. Okay? They influence you. So please try to team up with people that will motivate you. Try to team up with people that are serious, that give priority to passing their exams than any other thing. All other things will come up subsequently. During your discussions, you have jokes, you have some play, eat food, you do that, but it shouldn't predominate in the discussion. You wonder whether they are discussing stocks or they are in a market. 5 minutes, 10 minutes, play, laugh, go back, resume your activities, okay? So you have to team up with serious people, serious-minded people. Now, there are some candidates that they are not just serious. They are not just serious. You can't just do anything about it. Is it in their nature? They are not just serious. And when they fail the exams, it doesn't even bother them. There are some people that you can't help. So please just be very, very careful on the kind of people you team up with to prepare for your exams. Always remember the effort your parents, your guardians, your loved ones have put into this. Always remember expectations from you. Okay? You are not A, you are not the same as B. You are all different people. Just know who you are. Know the expectations. Know that so many people look up to you. You have to be a serious person. Make your parents proud of you. Make your loved ones proud of you. Make your younger ones look up to you as their mentor. But when you show lack of seriousness, people will take you unserious. Now, procrastination. I will do it tomorrow. Now is the right time. There is no tomorrow. Tell yourself, there is no tomorrow. Now is the right time. If you want to prepare, start preparing. Because tomorrow you will always find another excuse. So if you are ready to pass, you have to wake up, prepare, and pass. Double-blind trial. You see, the blind cannot be leading the blind. Okay? You have to acquire guidance from people who know what they are doing. Please. You can't be carrying false information to a professional exams. Okay? Unfortunately, there are some people looking for shortcuts. Okay? They think they can buy their way to these exams. Okay, let me tell you something. I've participated in these exams. In the 2 exams, I participated as an examiner. There is a chief examiner. He comes in with the questions, sealed. And he will raise the questions and show all the examiners. Did you see the envelope sealed? Everybody will respond. He will show you the front and back. Then he will now open the questions in forms of everyone. Then he distributes the question based on your stations. So anybody that is telling you to pay, he's lying. He will just use your money unnecessarily. And for God's sake, how ethical, how really unethical is this? You want to be sworn in? You want to take an oath for saving the life of people based on falsehood, based on malpractice. You swear with the holy book you believe in. At the end of the day, during that oath taking, and you want to acquire that through malpractice. So please and please, this is something you can do. Never doubt yourself. It is doable. It is possible. Just sit up, do the right thing, be with the right guys, do discussion frequently, go over all these things we mentioned. And I assure you, you are going to pass. Now, there are some candidates that will tell you they know it all. They know it all and they are not passing. They will tell you, see, I've written these exams 5 times, so I know it all. If you know it all, you will not write it more than once. And these kind of people are problematic. They will tell you there's no need for you to do any tutorials. It's not true. There are various credible classes all around. Join. Okay? But let me tell you, tutorials will not help you if you are not ready to pass. It will never help you. The most important thing is from you. Okay? All these are just guidance, just to put you on track and to tell you what you are supposed to do. But the bulk of preparation comes from, none of your tutor will go and write these exams for you. If I see you in an exam, I will not give you extra mark. I might only guide you if you are derailing. That is even in the OSCE. That might not even change anything. The MCQs is what really determines, and that tests how deep you have read, how wide you have read. So avoid a lot of hearsay. So these are some points talk about. Now we've come to the most important aspect of this orientation, which is the question and answer session. So I'm going to unmute you all, or I'll allow you to unmute yourself. Question and answer session is the most important aspect of this orientation so that you get clarification. So if you have a question, please you should identify yourself, say your name, then you mention your status, whether you have written the exam before or not. Then you now ask a question. I'll address it. If you don't have question, remain unmuted. You don't distract us. If you have question, that is when you unmute yourself so that you don't cause a lot of disturbance in your background. So please, if you have any question, you can ask. This is the most important aspect of this orientation. So ask questions, ask for clarifications. Then we'll answer them to the best of
Good afternoon.
Good afternoon.
Okay, please, my name is Malik Wina. This is my first time to write the exam.
You are welcome, Dr. Malik.
Thank you, sir. So my question is, the time is short, like just 4 months remaining, and using these standard textbooks, the textbooks are big. And also you have to practice a lot of MCQs. Those MCQs takes a lot of time. So initially because I heard a lot of people say, just use the guide, cram it, learn it very well is enough with MCQ practice. So right now, would you advise me to focus 100% on the guide plus MCQ practice, or I should focus more on the big textbooks plus MCQ practice? Thank you.
That is a very good question from Dr. Malik. Now, you see these textbooks, you use them to read high-yield topics, okay? You use textbooks to read high-yield topics. The guide is not a replacement for textbook. The guide is mainly used for group discussion. You cannot use the guide as a substitute for textbook. The guide is a very good key point, and it is used for refreshing your memory on what you have read. Do you understand? If you follow all these points and you are well organized and you avoid so many distractions, I assure you, you can read those high-yield topics and jottings from textbooks. The challenge or the problem most candidates face and repeatedly make is they use the guide as their primary source of information, which is very, very wrong. You see, these examiners setting question, they understand your psychology, they understand the philosophy, they know what you are. If you are going for a battle, you have to understand your opponent and his weapons, his strengths. When you use the guide, who will set MCQ with the guide? Nobody will use 300 MCQs where you are giving consultants and professors to set MCQs, and they'll go and take the guide to set MCQ. You know that information, it doesn't even make sense. Do you understand? So the truth, I have a very good candidate. He has never even read the guide before. I always see him reading recommended textbooks we use here. He's one of my exceptional students I ever met, ever. He has never read the guide before. I'm not discrediting the guide. It's a very good and excellent key point for your group discussion, okay? For revising what you have read, but it should never be the primary source of your information. In fact, all of you should have the guide. All of you should have it. But it is not a replacement for textbook. You cannot keep on repeating the same mistakes. This is the mistake people make that makes these exams to record fatality. Okay? I hope this answers your question.
Yes, sir, it does. Please, I have one more question.
Go ahead, Malik.
For some subjects, they don't have high yield points. For example, ENT, ophthalmology, anesthesiology, dermatology, all these subjects, like there's no really a list of high yield topics for them. How do we do with these subjects?
This is also another good question. You see, a candidate that has written this exam will just come out from nowhere and tell you they ask anesthesia, they ask dermatology. See, let me tell you, it's not actually anesthesia they are asking. Let me give you an example. In surgery, there's a topic that is pre-operative preparation of a patient for surgery. Do you understand? So there are some areas that talk about anesthesia in that topic that is relevant for the exams. When you read those areas, it suffices what is good, what is enough for you to pass the exams. That is the first point. Secondly, all those questions that are asked from these minor subjects that you do short postings, during the exam, they do not constitute up to 5% of the question. Why will you concentrate in reading 5% and you leave out 95%? Because of hearsay. Do you understand? So please and please don't be distracted with something of least importance instead of focusing on what is more important. So concentrate on during these, those dermatology questions you are seeing, they are from internal medicine, please. Dermatology is part of internal medicine. Nobody will be asking you pharmacology. It's just a treatment of a particular ailment that's featured in the question. They will now think that it's pharmacology they ask. Okay? ENT. See, ENT, you see, what I will advise regarding all these 5% minor courses during your training in school, you have your lecture notes for this course. You can just brush over it. If you are not satisfied, or if you are not convinced, or you are not really sure if you are not ready. But what I'm telling you, nobody failed this exam because of an anesthesia question, which is 1 or 2, or ENT question, that is 1, or pharmacology question that may not even, nobody failed these exams because of that. Is it clear?
Yes, sir, it's clear. And sorry, last question. For example, like each of those 5 major subjects you said we should focus on, approximately like how many MCQs each should someone do before the exam to feel prepared? And also, are we going to get the recommended textbooks names and high-yield topics name from you?
Yes, that is a very good question. See, I usually tell people read, read, and read until you forget that you are reading, meaning it has become part of you. I won't tell you to read 200 MCQs, 1,000 MCQs, and it's enough. Just read and read and read until you realize that when you pick up a material, you notice that you have read it already. When you notice that you have start looking for materials like ENT, because you are already saturated. So just keep on reading until it becomes part of you. It never ends, because the more you acquire knowledge, the more confident. You develop more confidence, okay? And let me tell you, the secret of passing any exams, 1 is stuff. You must have stuff, okay? You must be very confident. And confidence comes with a lot of knowledge. You must be organized, okay? You must be organized, okay? There should be precision when you are describing everything, and you must be very eloquent, okay? Most importantly, you have stuffs. So just keep on reading, answer as many MCQs as you can. Okay, that is regarding, then issue of recommended textbooks. You see, here in Nigeria, the textbooks we use are well-known textbooks for medicine, surgery, pediatrics, O&G, okay, public health. I'm going to share the names of those textbooks with you, and or maybe I'm going to give you a separate orientation on the review of those books and how to use them. But basically, we have recommended textbooks. I know in my own area of specialty, the textbook we recommend is Bedu. We call it Baja. It's a tropical textbook. Surgery. Bailey and Love is something you all know. I'm not, as I told you during the orientation, you wouldn't read all these textbooks from page 1 to page last. The trend these exams is taking, okay, where they are assessing the depth of knowledge. If people don't go back to textbook, this mortality will continue the way it is. You cannot afford to just keep on reading key points. Nobody will pass these exams. That is a false impression. At least I know what is going on. This exam is becoming more complex. They want to maintain a standard the way our MBBS final exam is, and these are the textbooks they use. So you have to surprise everybody by changing the narrative, okay? You have to read textbooks, especially the high yield topics. You can't read everything in a textbook. And after all, how many hours does it take you to read the guide? And how many hours will it take you to read that particular topic? Just read and jot. When you are organized and you have a comprehensive jotter, you read and jot. Nobody say you go back to that textbook again to read the same topic. You already read and you have jottings. So you go back to your jottings, it will refreshen the stuffs you read. And when you come for group discussion, you have the guide and you have your jotter. You share the information. I hope that answers the question.
Yes, sir, it does. Thank you so much. I'll be waiting for the list of textbooks and the high yield topics later. Thank you, sir.
Okay, that one will take another an hour or two. That's why I will do that, God willing. Any other
Thank you
questions?
so much.
You are welcome.
Yeah, me.
Okay.
Good day. My name is Aisha Abdullah, and I'm writing the exam for the first time.
Excellent. You are
My
welcome.
question, thank you, sir. My question is with the section of surgery in the exam, you said the high yield topics are, like you mentioned them, like 5 ops, pediatric surgery, excluding those Malik mentioned, like ophthalmology and anesthesia. What I want to know is like topics regarding like orthopedic surgery, urology, neurology, neurosurgery. Will you classify them under the umbrella of surgery? Like when they're asking the 50 questions that are for surgery, do they diversify or are they mainly focused on general surgery only? Or they split them with orthopedics and the other subspecialties that are under surgery?
Okay, that is a very good question. Now, what you should know, there are topics in surgery that are in one red book or green book, as the Mdcn call it. And those topics are the curriculum for Mdcn exams. It covers all the specialties in surgery, not only general surgery. There are topics from general surgery, there are topics from urology, there are topics from orthopedics, there are topics from pediatric surgery, there are topics from plastic surgery. All the topics are there. For example, if you take plastic surgery, burns is a plastic surgery topic. If you take pediatric surgery, anorectal malformation is a pediatric surgery. If you take orthopedics, chronic osteomyelitis is from orthopedics. If you take neurosurgery, hydrocephalus is from neurosurgery. So all these topics cut across the specialties in surgery, for example.
So basically, So basically what you're saying is the 50 questions that I should expect when I go in for the exam, I should expect them to come from all angles in surgery.
Yes, all the specialties in surgery.
Because I thought they would give more importance to like general.
You know, general surgery for undergraduate is usually principles of surgery. That is where general surgery covers. Then some important high yield topics. When I say principles in surgery, they include fluid and electrolyte therapy, blood transfusion, shock, infection, and all that. Then there are some important topics like that a house officer should be able to manage at the emergency, intestinal obstruction, manage, what I mean by manage, resuscitate at presentation. Okay, patient presenting with intestinal obstruction, patient presenting with peritonitis, okay, patient presenting with trauma.
Okay? Emergency cases, yeah.
Yes, emergency cases.
Okay.
Patient presenting with urine retention, you see, it's part of urology.
Yes.
So
yeah, I do.
What will happen, I'm going to give you a review of the high yield topics, okay, in all the various specialties. I'll make a video and share it with you guys so that you understand the scope of what we are talking about.
Okay.
Yeah.
Thank you so much. I understand.
Yes, any other question?
Yes, sir.
Good afternoon.
Okay.
Good afternoon.
My name is Mohammed Yusuf. I'm writing this exam for the first time.
You're welcome, Mohammed Yusuf.
Thank you, sir. Earlier you make mention of exam accidents. So I would like to know if there are any specific exam accidents that students normally repeat so that we can be able to avoid them.
It's an excellent question. You see, most of the exams, I usually go to the venue, even though I'm not participating in the exams, because my students, I follow my students for the exams. I go with a first aid box. Sometimes somebody will collapse. Sometimes somebody will go and eat something and they will develop gastroenteritis. And they will require some intervention. Some, it will even happen in the exam hall. You understand? So these might happen. And of course, candidates will need help and it will affect the outcome of their exams. That is one. Sometimes somebody might mistaken a question. Somebody's computer might just go off. I could remember when I was writing my JAM exams. So my chemistry paper was blank from, that was in 2002, by the way. My chemistry paper was blank from page number 1 to 15. And there was no type. It's not CBT we do, is a hard copy and you use HB pencil to shade. So my type, there are various types, type S, type A, type B is different from another candidate's type. My type was not in that center. So that's an exam accident. They just do happen and sometimes you can't do anything about it. You are well prepared. There was a year that one of my best students went for the exams. She did not pass. When I was checking the list of successful candidates, I did not even check her name because I believe she passed the exam. Not until later when I now check. And of course, it was an exam accident. Something happened along the line. She missed a question and answered so many wrong questions. Okay, so sometimes there are some unforeseen circumstances that may happen in the exam. So you have to be very prayerful so that such things don't happen. I hope it's clear.
Yes, it's clear. Thank you.
Yeah, well. Yes, any other question?
Yes, sir. I have a question. My name is Abiza, and it's my second time taking this exam. What?
Dr. Hadiza, you are welcome.
Abiza, thank you. So I discovered that my problem is not the OSCE because I nailed my OSCE. Even after the exam, I had to call my dad and I was very happy. But So I was thinking, in fact, it is the CBT. And those accept questions that it's an accept question, but the answer is the wrong one.
Yeah.
Or I don't know, like all those accept questions and all of that, the way Mdcn said, yeah, because it's not straightforward like flap that okay, it's da, and you know that okay, A is the answer, or C is definitely the answer, or like okay, this then you will know that C is the most correct answer or something like that. Like Mdcn, I don't know, like that is kind of tricky. And most times you just see a question and your brain will be like, oh, I know this answer. Wow. And you will pick it. But after maybe you're revising it to your friends after the exam, and then they'll be like, oh, like there are other options too that were like also right. Do you understand?
Yeah.
Like there were like 3 right answers. Yes. And you just picked one
Okay, that is a
instead
very
of picking the wrong answer.
Yeah, that is a very good question. And she raised a very important point that you should all take note of. Now, majority of these candidates, they do well in their OSCE, but you should know that OSCE will never complement a mark, even by 1. It will never complement the MCQs. Now, people hardly fail OSCE. People hardly fail OSCE because if you have 10 questions and maybe you get failure is 4 downward, 4, 4, 4 in 3 stations. And you now get maybe 6, 6, 6 in 3 other stations. Okay. And the rest of the 4 stations, you got 5, 5, 5. You see, these 6, 6s will complement this 1, 1. You see, you failed 3 stations. Okay. And this 1 marks complemented and everything spread across to become 5. It is when somebody get 0. And how will you get 0 on a station, for God's sake? For just greeting, you get 1 or 0.1. Seeking rapport, seeking consent, okay? And all those preambles, you get some marks. Except you go to a station and abuse the examiner and the candidates. How will you get 0? So it's when you consistently, when you have 0 in 2 stations, 0 in 1 station, and you fail, you get low marks in other stations. Or you consistently get low mark in all the stations. That is when people fail OSCE. Now, coming to this MCQ, what you should know about it is that it is a single best option. It might be the only correct answer, and it might be the only odd answer. Now, when you now see multiple correct answer, okay, you know you are looking for the odd one out. Okay, when you see multiple false answers, it means you are looking for a single best option. And true or false is no longer done because it's in true or false, you do negative marking. For single best option, you don't do negative marking. Okay, so you should understand that this question, this MCQ, is a single best option. You pick the only correct answer or the only odd answer. And the way you succeed in doing this is what? Frequent practice. Please and please. Frequent practice of MCQs is very, very important. Hope I answered the question. Are you clear? Okay. Any other question?
Yes.
Since my network is
Oh, where to get this from?
the network.
Like that looks similar and certain.
I can't, your network is, I can't hear you. Can you come again? Network was shaky.
Oh, sorry. No, I was asking like where to get these questions that look similar to MDCN questions, like to get these MCQs. Yeah, to practice with.
Sorry, you can type your question while others ask, then I'll go through because your network is not really clear. I can't get the question. Just type it. Send it out.
Sir, excuse me, I have one more question, please.
Okay.
You said when you see multiple wrong answers, it is safe to pick the right one, or when you see multiple correct answers, it is you pick the wrong one. So is it okay if I assume that there are no single best answers questions? Those that all the questions, all the options are correct, then you choose the single best answer. So they don't do best answer here.
SBA, single best.
So yeah, single best answer, the ones that
when you see all that are correct,
it's just a
when
single best answer, not.
If you have 4 options and all those options appear to be true, okay? Now, of those options,
Yes,
there is one that is more appropriate than the others. Maybe in that condition, that is the most common presentation of that condition. So even all others are present, but they are less common. They occur less frequently. So the most common will now be the best.
those questions are usually the trickiest because they give you all correct options and then they ask you to choose the correct one. It's much easier to just ask you a single wrong answer or a single correct answer. But then if they want to be wicked, sorry, they usually give.
Most of the questions are not like that.
Okay, that's a relief.
Are straightforward.
Okay.
A single best option or a single false option. Majority, only 5% or even less, you will see. Of course, most of the conditions where you have that kind of presentation are even few, you understand? And this has nothing to do with, it has to do with your preparation on how deep. You see where this issue of textbook come. All those things are textbook. You see all these kind of things, you will never see them in tiny keepings like that.
Okay, thank you.
Other question?
Hello, sir.
Yes, you are welcome.
My name is Javier Aminu. I was a former student of yours who wrote the Mdcn exam immediately after COVID-19.
Okay. Dr. Aminu.
So, yes,
is it Jafar?
Jabir, sir.
Jabir Aminu. Excellent.
Yes, sir. So, I'm here just to give my support to our younger colleagues and also some advice I want to give it to them. First of all, like you said, there should be a frequent questions, like they should practice a lot. We practice up to the time that during the COVID-19, we have to trek from our various locations to one location that is at the center just to practice the questions. So with more of the practice, that's what helps us that when you went to the exam, to be sincere, if you practice a lot, you can answer that questions, most of the straightforward question in one sitting. Thus, you will just read and you know the answer directly without even looking at the whole options. So they have to practice a lot. And also prayers matters a lot. Second of all, the recommended textbooks are, like you said, the Bajaj, they do. I think one of the most recommended textbook I would ask them to buy is that your compartment that you compile all the internal medicine, the surgery, the pediatrics, and then O&G topics. With them, there can be a guide so that they can further their reading with it. Because if you said they should read the whole that textbook, I think they will not have time to read everything and understand everything. So let them follow the high field textbooks. One of the recommended one is your textbook. I forget actually its name. It's also very recommended, very comprehensive, and you can get everything you want. Mdcn is not, to me, actually, it's not a do or die affair, and it's not that hard. All you need to know is what Nigeria wanted from you. Once you understand the way they think, you can pass the exam at least. And I hope them a very successful exam. Inshallah, it will be a success. Okay. Have a nice day, sir.
Very, very much, Dr. Jafar. I thought you have forgotten us, so you are still with us.
Yes, sir.
That is a wonderful comment, contribution, and advice from Dr. Jafar. I mean, he's one of our very, very serious and committed students. He made a lot of good observations, okay? And you see, he also mentioned issue of frequent practice and some recommended textbooks. Inshallah, I'll share the soft copy of the textbook. He mentioned we have a compendium for surgery tutorials. It has all the things you need for the exams as far as surgery is concerned. Then we have MedTutor's lecture notes. It compiles all the high yield topics from the various specialties. And that we don't have the soft copy, it's just the hard copy. And most of the candidates that are registered, they buy the textbook and they just use it as a guide, not to be disorganized. You want to have the high yield topic based on our own information in our local environment. So that is also helpful, okay? Thank you very much, Dr. Jafar, for your contribution. Yes, any other question, comment?
No, I have a question.
Okay.
Okay, so my first question is, I'm hearing a lot about repeat questions, and where do we get these questions to repeat? Where can we find this type of questions? Because, for example, on Mdcn groups, picture test group, all those groups, it's like people drop random different questions. Some of the questions, even the answers don't make sense. It's like people just post anything. Second question is, does questions repeat? For example, when we do these MCQs, like on the day of the exam, are we going to see, questions we've done before? And my third question is, this compendium of surgery that MedTut have, is it enough, or we should still use the big textbooks?
Well, it's not MedTut, it's MedTutors par excellence. I know some people
Okay, sorry, sir.
MedTutors with is it MedTuts or something? The compendium for surgery tutorial is also a textbook. In fact, it's not used by only undergraduate students, even postgraduates. Surprisingly, when I went for my Part 2 exams at Ibadan in Ibadan, okay, during that COVID. So we are doing group discussion with some of the candidates, and a candidate now say, okay, let me share a material. Let's use it for discussion. It's very concise and comprehensive. So they now brought out the textbook, not knowing that I'm the author of the textbook. We now started discussing. At the end of the discussion, I now brought out the hard copy that has all the pen writing and all that. And everybody was shocked. So you are the author of this textbook? I say, yes. So it's actually a textbook. That is the compendium for surgery tutorials. For surgery, actually, is enough for you, not even only for undergraduate, even for postgraduate, they use it because it hits the high yield topics and straight to the point. That is that. So it's not maybe jottings or something. Then for the lecture notes, they are actually drawn out. The main points are drawn out from textbooks to highlight the important points you need to know, especially with regards to tropical issues. Okay, so a lot of candidates also used it and they enjoyed the textbook, and they make a lot of recommendations on the textbooks. Because you see, I wouldn't be recommending what I wrote. That is not the entire aim of this orientation. The entire aim is just to get a successful outcome. If I start recommending books that I wrote, it will appear as if I'm just advertising them, and it will defeat the aim of this presentation. So if you get a recommendation elsewhere that this is a good book, I used it and it was helpful, you can also use it. And they are available when you want them. You can just reach out to me and you will get them. And of course, as they said, they used it and it was helpful. Okay, any other question? We have just 10 minutes to go.
I'm sorry, you didn't answer the first two questions I asked. Sorry, the first one was all these questions, MCQ, that we should practice with, where can we find them? And
Yes.
Second question is, does questions repeat themselves? For example, if we practice a lot, are we going to see those questions on the day of the exam?
What you need to understand is you don't need a repeated question to pass an exam. What you need is to cover the scope. You understand? Repeating a question will not, whether you see a repeated question or not, it doesn't really matter. Repeat questions are only meant for you to understand the scope of the exams. Do you understand? They are meant for you to understand the scope of the exam. So you don't look for repeated question just to wait, okay, I'm expecting to see this question, because if you don't see them in the exams, you'll be disappointed. If they are going to ask you question on obstructive jaundice, read everything about obstructive jaundice. And anyway the question comes, you pass it. It doesn't need to be repeated. Now, all those bank of questions that you see in many places, they are just to help you cover topics. Okay, they are just to help you cover topics. They are not actually meant for you to see them. After all, they are not even from the exams. It's not a repeated question from the exams. It's just various centers that set their own questions to help them train their candidates. Okay, it's just to help them train their own candidates. They are not repeated Mdcn questions. I could remember there was a time, one of the years I participated in the exams, our head of department asked me to set some questions. I set some question, I gave it to him, and of course in the exam I did not see any of those questions. So don't even think the questions are coming from the center. Mdcn have their own, they come with their own questions. And these questions, they are not questions that the center sets. It has nothing to do with that center that you are writing the exam. They have their own examiners that submit questions to them. I hope it answers the question.
Yes, sir. Thank you so much. And last question, sorry for the disturbance. There is this pediatric textbook called Azubike. It is super big, super big. I heard that's what they use in Nigeria. Should we use it?
Of course, that is what they trained us with. I told you, medicine in Nigeria is tradition. We take information from our seniors and transmit it down to our juniors. What I'm telling you about textbooks, you don't read textbook from page 1 to page last. Okay, just select some high yield topics, read them from textbooks. Then some other slides, some other materials you get, complement them. You can't read Azubike from page 1 to page last. It's impossible. Aside Azubike, even here, there are smaller recommended textbooks. Even in pediatrics, I think is it Jolie's? Jolie's. It's also a recommended textbook, and it's a small, concise textbook. And all the information you need for the exams, they are inside the textbook. Okay, so you can also use Jolie's. You can use the lectures that are delivered. You see, in our own center, all these lectures are delivered by senior registrars that are in the specialty. So no matter, they know how to give you information that is relevant for your exams. So that is very, very important. You can't read textbook, but the trainers, that's why you must get qualified trainers who are in the specialty that can give you what is necessary, and you can ask them questions. So the problem is you are using, see, if you have qualified trainers that partake in exams, that have experience in the exams, that will deliver lectures to you, and that is when you now start relying on books like the guide, even my own textbook, the lecture notes for med tutors. But if you don't have those qualified trainers, you are just doing double-blind trial, where you have the blind leading the blind. Okay, so that is the problem.
Thank you so much, sir. I understand.
Yes.
Yes, sir.
The lecture notes for the med tutors, like, it's comprehensive enough. I trust it is comprehensive enough. So if we use that with the textbooks here and there, are we good to go?
Yes, you can use it actually.
Because like, it looks very comprehensive and well detailed. Like, I went through it very vaguely, of course, not deep, and it seemed like it has everything that we need.
Yes, you can actually use it combined with the lectures and your group discussion. It will go a long way to help you.
It will suffice.
It will suffice, inshallah, because it's a textbook actually.
Yes.
It's a textbook.
Okay, thank you, sir.
So my name is Ayman Mohammed. I'm one of the recent students of med tutors, and I want to comment about the question that Malik asked about the repeated question. So what I'm saying is that when you are answering the past question, you have to use textbooks. I mean, like, just not just answer the question and like go forward, whether you pass, whether you know the question or you don't know the question. For example, what we are doing when we are studying med tutors, me and my friends, what we are doing is, like, after we wrote our mock, mostly we used to write the mock on sometimes Saturdays or Sundays. So we used to have the time where we go through again through the question, because after we read the mock, they used to send the mocks in the group. So we go through them again, and we are using textbooks. So we are discussing the question again. So you can use this as like, method of learning again. After you answer the question, you have to go back again and study it. And this helps us during the, examination, this Mdcn examination, because there is some, for example, during the picture test question, the first question I think they brought during the picture test, it was the same question that during the previous examination that was taken in Ibadan. The tutorial that you took, there is one picture, if I could remember, the patient, there is one boy that comes with facial palsy, and it's the same picture that they asked, but they asked, the question is different pattern. It's not exactly like how we attend the previous one. So what I'm saying that is, when you are answering the question, the past question, you have to use your textbooks and to know what you are answering. So thank you.
Thank you very much for that important comment, Dr. Ahmed. Dr. Ahmed is one of our very, very consistent past students. And of course, he sat once and passed with a flying color. You can see, based on his own experience, he's telling you what they did. And of course, you use textbooks. I told you, when you are doing group discussions, you should have textbooks around. Nobody is telling you to read a textbook from page 1 to page last. No, you use that textbooks to clarify and read high-yield topics. Any way they twist the question, you can answer it. Because nobody will be using shallow information to be setting multiple choice. These are professors, consultants, and many trainers. In these last exams, I met a trainer, one of the examiners. I met him at the airport. He's my teacher in the undergraduate. And before I even joined medical school, he has been training students for the past 10 years. I met him going for the exam. You expect that kind of person to go and take the guide and be setting MCQs? It's impossible. So you need your textbooks. Those are the bedrock and the foundation of medicine, because any information you see in a textbook, they are information that have gone through meta-analysis, systemic reviews, highest level of clinical research. They are now documented in textbooks. Okay, they are facts. So that's why you need textbooks. That is a very excellent contribution from Dr. Ahmed. Thank you very much, Dr. Ahmed. It's time we'll just take the last question or comment, if we have any, then before we go. If there's a question, I'll take the last question before we go. And this orientation is recorded, okay? And I will share the recording immediately on the YouTube channel, which is this, okay? And I will also make a video on the recommended textbooks and high-yield topics, and I will share it on the channel. So you can just look for the channel on your YouTube and subscribe it, so that, and press notification, so that anytime I upload, you will see. And if you have any other clarification, this is MedTutor's WhatsApp number. You can chat me through this number and I'll respond to your question. So you can share the orientation to all your colleagues, especially all those that are preparing for the exams. Let them have it. You can go through it multiple times so that you can take note of the points. So in the absence of any other question, we are going to stop here. And thank you very much, everyone, for participating.
Thank you so much, sir. This was very helpful.
You are much welcome. Thank you very much.